Hormonal decline is a natural part of aging, but it can also result from certain medical conditions or lifestyle factors. As hormone levels decrease, you may notice changes in energy, sleep patterns, weight, and even mental clarity. Women often experience symptoms around menopause, while men might notice changes due to lower testosterone. These shifts can impact emotional well-being and physical health. Understanding the signs of hormonal decline is the first step toward seeking effective support or treatment options. Causes of hormone decline. 1. Age. Men. Testosterone gradually decreases after age 30, 1 to 2% per year. Women. Estrogen and progesterone decrease sharply in the premenopause/menopause stage, usually after age 42 to 50. Testosterone also decreases in women with age. Other hormones, such as thyroid hormones, cortisol, can also decrease due to aging. 2. Pathology. Endocrine disorders, pituitary gland, adrenal gland, thyroid, ovaries, testicles. Chronic diseases such as diabetes, obesity, metabolic syndrome. Polycystic ovary syndrome, PCOS, in women or hypothyroidism. Cancer or damage to the endocrine glands. 3. Unhealthy lifestyle. Chronic stress increases cortisol, inhibiting the production of other hormones. Lack of sleep, not getting enough sleep affects hormone balance. Diet lacking in nutrients, especially zinc, vitamin D, omega-3s, or healthy fats. Alcohol abuse, smoking, or substance use. 4. Medical factors. Side effects of medications, birth control pills, corticosteroids, opioids. Surgery to remove the ovaries, testicles, or cancer treatment, chemotherapy, radiation. Improper use of hormone therapy. 5. Environmental factors. Exposure to endocrine-disrupting chemicals, BPA in plastics, parabens, pesticides. Environmental pollution, toxins accumulated in the body. 6. Genetics. Some people are at risk of hormone deficiency due to genetic factors or family history. Symptoms of hormone deficiency. Symptoms depend on the type of hormone deficiency, gender, and severity. Here are the common symptoms. 1. In men. Physical. Fatigue, muscle loss, increased body fat, osteoporosis. Sexual. Decreased libido, erectile dysfunction, decreased sperm quality. Mental. Depression, irritability, difficulty concentrating, loss of motivation. Other. Hair loss, dry skin, hot flashes, insomnia. 2. In women, mainly due to decreased estrogen, progesterone, or testosterone. Physical. Fatigue, weight gain, decreased bone density, muscle and joint pain. And sexual. Decreased libido, vaginal dryness, difficulty achieving orgasm. Mental. Anxiety, depression, brain fog, difficulty concentrating, mood swings. Other. Hot flashes, night sweats, hair loss, dry skin, irregular periods, premenopause. 3. General symptoms, related to other hormones such as cortisol, thyroid hormones. Persistent fatigue, decreased energy. Unusual weight gain or loss. Sleep disturbances, sleep apnea. Sensitivity to temperature, unusual hot or cold. Unstable blood pressure, rapid heartbeat. How to prevent hormonal decline. 1. Maintain a healthy lifestyle. Exercise regularly. Combine strength training, weight training, and cardio, HIIT, jogging. 3 to 4 times a week to stimulate hormone production. Avoid overtraining that causes stress to the body. Get enough sleep. Ensure 7 to 8 hours of quality sleep each night, prioritizing deep sleep to balance hormones. Control stress. Practice meditation, yoga, deep breathing, or relaxation activities to reduce cortisol. 2. Balanced diet. Supplement foods rich in zinc, oysters, red meat, pumpkin seeds, vitamin D, fatty fish, egg yolks, sun exposure, and healthy fats, avocados, olive oil, nuts. Increase fiber-rich foods, green vegetables, whole grains, to support hormone metabolism. Limit processed foods, sugar, and trans fats. Drink enough water. Avoid abusing alcohol or coffee. 3. Control weight. Maintain a reasonable body mass index, BMI. Obesity increases the aromatase enzyme, converts testosterone to estrogen in men, and causes estrogen disorders in women. Avoid rapid weight loss or calorie deficit, as this can reduce hormone production. 4. Avoid harmful agents. Limit exposure to endocrine-disrupting chemicals. Use BPA-free food containers. Avoid cosmetics containing parabens. Do not use hormone supplements or medications, such as testosterone, estrogen, without a doctor's prescription. Minimize exposure to environmental pollution and pesticides. 5. Regular health checkups. Perform regular blood tests to check hormone levels. Testosterone, estrogen, progesterone, thyroid hormones, cortisol, if there are abnormal symptoms. Consult an endocrinologist, andrologist for men, or gynecologist for women for timely advice and treatment. If necessary, your doctor may recommend hormone replacement therapy, HRT, or other treatments, but must be closely monitored. 6. Support mental health. Maintain positive social relationships. Participate in community activities to reduce stress. If there are signs of prolonged depression or anxiety, you should see a psychologist or psychiatrist. Thank you for watching the video. Wish you and your family good health and happiness.